Hey everyone, this video is about heart disease. Why do we have a whole video on heart disease? Because heart disease is a major killer. In fact, nearly half of adult Americans have some form of cardiovascular disease, and it's the leading cause of death in the United States, resulting in nearly 1 million deaths annually in the United States. So we have to take heart disease seriously, and that means in a class on the human body and health and disease, clearly heart disease is going to be a significant role, right? So, what kind of heart disease are we going to discuss? Well, in particular, we're going to look at heart failure, and we're going to look at 5 different possible causes of heart failure. Heart failure could be defined as the inability of the heart to provide adequate perfusion to organs and tissue. In other words, it's not necessarily a heart attack that the heart has stopped functioning entirely, but that the heart is not functioning well enough to provide the oxygen rich blood necessary to support all your organs and tissues and remove the carbon dioxide and other things that we've talked about with circulation. So what are the 5 causes? Well, there's basically 5 things that can go wrong. One is we can have an electrical issue. The other is one of the valves, or many of the valves, could not be functioning properly. So we've got electrical failure, valvular failure, myocardial failure. In other words, the muscle tissue of the heart could stop functioning properly. Coronary failure, which is the coronary arteries, the arteries that are bringing blood to the myocardial tissue, are not functioning properly. And lastly, pericardial failure. And you remember that para in medicine means close to or around or near. So the pericardial sac, that is that sac that is around the heart, could be stopping the heart from functioning properly. So let's talk about each one of these in turn. First, electrical failure. We've already talked a little bit about this when we talked about the electrical system of the heart, right? But one of the possibilities is basically a communication failure between the nodes. That is to say, the conduction of that electrical signal from the sinoatrial node to the AV node, or from the AV node to the remainder of the heart, the ventricles, could have some kind of disease or dysfunction to it. If it happens between the SA node and the AV node, we call that a heart block. And there's different kinds of heart blocks. You might remember this EKG readout here, which shows what we call a second-degree heart block. A first-degree heart block, you don't need to memorize this, but just so you have a sense of it, a first-degree heart block is when the delay between the 2 nodes is a little longer than it should be, a little longer than 1/5 of a second. A second-degree heart block starts to get more serious. That's when the delay is more significant, and sometimes the signal from the SA node to the AV node is lost or dysfunctional. So in this case, if you look at this EKG, you can see that we've got that initial bump that indicates the atria depolarizing. So it indicates the atria is squeezing in, right? We call that the P wave. And then we should have a QRS complex after that, which is the ventricles squeezing and the atria opening back up. And you'll notice that in this case, we don't always have that. So that's a second degree or partial heart block. This next image here shows a third degree heart block. And in this case, if you look at it, there's almost no relationship between what the atria is doing and what the ventricle is doing. So in this case, we have a complete loss of communication, a complete loss of conductivity of the signal from the atria to the ventricles. So the atria are doing what they do, which is beat at somewhere around 60, 70, 80 beats per minute. And then the ventricles are doing what they do, which is beat at a slower pace. So one telltale sign of what we call a third degree heart block is that the atria, the P waves, are coming more quickly than the QRS complexes. And remember, we talked about that. That's because the inherent rate, the rhythmicity of the SA node is somewhere between 60 and 100, typically somewhere around 80, something like that. And the inherent rhythmicity of the ventricles tends to be more like around 40. So we have disconnection between the two, and they're each going at their own pace. You can imagine what this does to cardiac output, right? I mean, the ventricles are not being fully filled, and the atria are just kind of doing whatever they're doing and not providing any support at all. This is not great. So this is a pretty serious condition that's going to require some pretty immediate medical intervention. Another possibility is you could have what's called a bundle branch block. That is to say, the conductive pathways, the bundle branches that go right and left, that bring the signal to the apex, to the bottom of the heart, those could not be operating properly. Or the Purkinje fibers may not be operating properly, in which case we may not have an adequate ventricle squeeze, or maybe that ventricle squeeze isn't happening effectively enough to, like a tube of toothpaste, push the blood out effectively. But the more significant dysrhythmia, these are all dysrhythmias, right? Because we have a rhythm, but it's messed up, dysrhythmia, which also in medicine, by the way, as a side note, is typically called an arrhythmia. I try not to call it an arrhythmia because it bugs me, because an arrhythmia would mean no rhythm, but there is in fact a rhythm. It's just not a good rhythm. So some folks will use dysrhythmia, some will use arrhythmia, but all it means is that the normal desirable rhythm of the heart is not functional. Okay, so a more significant dysrhythmia is fibrillation. And remember what that is, it's sort of an electrical storm of the heart where maybe some of the cells are activating other cells that have a more delayed function to them. As a result of that, we've got sort of madness with electrical signals going in all directions. So the heart is not actually pumping at all. It's not pumping fast, it's not pumping slow. It's just quivering as different parts of the heart's muscles, different parts of the myocardia are doing different things all at the same times in a indistinct pattern. So if we looked at ventricular fibrillation, we'd see this kind of craziness on this EKG here, where there's no clear pattern to it, nothing's good happening, and no blood is being pumped at all. Another possibility could be a more modest effect where just the atria is having that fibrillation, and that would look like this EKG here, in which case you can see that the baseline is sort of a crazy line as the atria are quivering, but the ventricles are still pumping. However, they've lost their rhythmicity. They've lost their regularity because the pacemaker for the heart is diseased and not functioning properly. As a result of that, you've got the QRS complexes, you've got the ventricles pumping, but not regularly and not consistently. So that's a fairly significant issue, but somebody could live with that, though they're going to experience weakness and probably some other effects as well. So all these are electrical failures. Before I leave this topic, let me point out one more crazy possible electrical failure, which is you could have what's called PEA, pulseless electrical activity, which strictly speaking is not an electrical failure, but it could be that the electrical system in your heart is functioning properly, it's just the muscles are not responding. So the connection between the electrical system and the mechanical system is broken, and that's probably because the mechanical system itself is diseased and unable to respond. But the weirdness of that is this person would be effectively dead because their heart is not pumping. But if you connect them to an EKG, the EKG would look relatively normal because the electrical system is functioning. And the EKG is only measuring the electrical system. It doesn't mention, or excuse me, it doesn't measure heart function. It measures electrical function, and the electrical function is fine. Another possibility is valvular dysfunction. That is to say, the valves, either the mitral valve or the tricuspid valve, or perhaps one of the semilunar valves, but one of the valves is not operating properly. Now, if you think about it, there's basically two possibilities here. Either the valve is not opening fully, or the valve is not closing fully. So it'd be a mechanical failure of the valve, which in medicine we call valvular incompetence. The valve is not operating competently. So valvular incompetence could mean that the valve is not closing properly. It's too loose and it's opened up. It could be that the chordae tendineae, remember those cords that are tough connective tissue that are holding the leaves of the valve in position, could be that those have failed. More likely, the base, that is where those are connected with muscle tissue, the muscle tissue has failed. So if you think about this, if you've got, for example, some sort of disease process in the heart where some of the heart muscle has died and the heart would otherwise be functional, except that some of the muscle is not functional, but the heart might still be reasonably functional. If it is at the base of the chordae tendineae, if it is at the base of where that connection is made, then the valve could become incompetent because it doesn't have that firm connective tissue holding it in place. So one possibility then is it's too loose and too weak. And you might think, that's not such a big deal because it still allows the blood to flow through. That's true, but it won't stop regurgitation. It won't stop the blood from flowing back in the other direction. So that when the ventricle squeezes, for example, if it's the left ventricle, some of the blood shoots back up the mitral valve and into the left atrium, and therefore we lose some cardiac output as a result of that. Or it could be that the valve is just too tight, in which case, let's say it's a semilunar valve, the ventricle is squeezing, but it's not getting full evacuation of the blood out of the heart. So this image here kind of shows you both of those, right? In this case, this is a mitral valve, which is a critical valve, and we want it to operate. One possibility is that the valve is allowing regurgitation because it's too loose. The other possibility is the valve is too tight, and we call that valvular stenosis. One other possibility, which is kind of interesting, is you could have a growth on the valve. And interestingly, in medicine, we call that vegetations. So valvular vegetations is not a lovely little garden on your valves. It's something growing on your valves, a bacteria or something else that is actually getting in the way of the valve's mechanical operations and sort of jamming things up. And sometimes you'll get sort of other clots building up there, et cetera. But you can imagine that being a problem. How does that happen? You get some kind of bacterial infection in your body, and your body is able to clear it. Your immune system, that we talked about, launches, a response, an inflammatory response, and it kicks the bacteria back, except that the valves disturb flow. So around the valves, you've got some turbulent flow that creates quiet spaces where the blood flow is not that aggressive. Remember we talked about that when we talked about flow through the blood vessels. So in those spots, the bacteria can settle in, it can find a home, and it can grow. And then you've got stuff growing on your valve. Here's an image that's medical imagery, and you can see the arrow pointing to that little dark spot. That is a bacterial growth, and you can see that it's actually on the mitral valve. So that thing just to the left of that clump with the arrow on it is the mitral valve, and that is a valvular vegetation on the mitral valve that's going to interfere with that valve's operation and therefore interfere with the heart. That's not good news. So another form of heart failure is myocardial. Now, to some degree, you could say, isn't all heart failure myocardial because doesn't the heart muscle always fail? Yeah, but in this case, what we're talking about is the muscle itself having a problem, a disease function, or some kind of disability that causes the muscle to not respond even though the rest of the heart system is operating properly. One possibility, by the way, could be just an electrolyte imbalance. That is to say, the heart muscles are very sensitive to the amount of sodium, the amount of magnesium, the amount of key electrolytes you have in your system. And if your magnesium or your sodium or other things go out of whack, the electrical conductivity through the myocardium is going to be problematic. So you might get an electrical failure, but you can also get a muscle failure, a myocardial failure. Another more common possibility is toxins. And that could be the result of a lot of things. Radiation therapy frequently causes this. So you've got cancer, you're getting radiation therapy, that is causing injury to the myocardium. It's not repairing and rebuilding itself effectively because of the radiation, and that might lead potentially to heart failure. Maybe certain medications, some antibiotics, some antidepressants might lead to myocardial injury and potentially heart failure. Toxins, for example, exposure to carbon monoxide might mean that because the carbon monoxide bonds with the hemoglobin and therefore stops the hemoglobin from carrying oxygen, you're not getting enough oxygen to your heart tissue. And as a result of that, the heart tissue suffers from lack of oxygen and can potentially suffer injury. And so you might get a heart failure as a result of the muscles not getting enough oxygen because you were exposed to carbon monoxide. Other possibilities might be an autoimmune disorder. You get the idea. Certain kinds of disease processes are going to lead to injury to heart muscle, and that could lead to heart failure. Another possibility is what we call coronary source. And a coronary source is when the vessels, the coronary arteries that bring blood to the myocardium, get usually clogged or somehow unable to bring blood into the muscle tissue. We've talked about this before. You remember the term atheroma, right? That blood clot. You remember the term atherosclerosis. So this is what's happening. And this is a very, very, very common spot for atherosclerosis, right? You get that inner lining of the artery that breaks away as a result of high pressure, because maybe you've had chronic high pressure or hypertension for a while. You then get some deposits in there, right? Maybe some bad cholesterol building up in there. Maybe phagocytes come in there, they eat up the cholesterol, they get all fat, and then they die in that pocket. And then other things start building up in there, and pretty soon it's blocking most of or all of the artery, and that portion of your heart is not getting adequate blood flow. That could be a real problem. And if in particular it's one of the arteries that brings blood to the left lower part of your heart, that's key, because that's the hardest working part of your heart, right? That's your left ventricle that's pumping blood into your system. So if that starts failing, you're going to feel it pretty quickly. When that starts, we call it ischemia. So when any tissue is not getting adequate oxygen because of poor blood flow, we call it ischemia. And then when that tissue perhaps ends up dying as a result of the lack of oxygen, we call that an infarction. Or sometimes we say infarcted tissue, right? Or sometimes we call the region of tissue that's damaged an infarction. So the infarction is the irreversible damage to tissue as a result of ischemia, which is a lack of adequate perfusion of oxygenated blood. Now, suddenly something might make sense to you, because often we call heart attacks myocardial infarctions, or MI. So people will say, oh, this person had an MI, it was terrible. What does myocardial infarction mean? Myocardial, we know, means heart muscle. Infarction means the heart muscle was killed as a result of lack of adequate perfusion, and you know why that happened, because there was an atheroma there that blocked adequate flow of blood through one of the arteries that delivers blood to the heart. One possibility, by the way, before I leave this topic, is you could have angina, which is a more modest blocking of one of the arteries that leads to a certain weakness. What happens is one of the arteries gets partially blocked, and as a result of that, whenever you try to exert yourself, for example, whenever you go up a flight of stairs or walk a little too far or a little too fast, you'll start feeling chest pain. And what's happening is your heart muscle, we talked about this before, which is operating at 100%, it's using all the oxygen that's available to it, suddenly is deprived of oxygen. You start feeling the effects of moderate ischemia as the heart muscle starts to suffer by a lack of oxygen, right? And the reason it's suffering is because the heart can't get enough blood through that partially blocked artery. So people will often have angina, and typically, they deal with that by maybe taking medications that are going to open up the vessels a little bit more, usually take a medication that I'll talk about later that's going to slow down the heart and relax the heart a little bit. And then if they have an urgent situation where they got a lot of pain, the physician might have given them some nitroglycerin, which is going to have the effect of really opening up the vessels. So their physician might say, here's the nitroglycerin tablet. If you really start feeling the pain, take the tablet. It'll dissolve under your tongue. It'll open up all your vessels. That will allow more blood to flow to your heart and relieve the pain and relieve the issue. So people with angina may have something like a nitroglycerin tablet that they keep around in case of an emergency. So those are coronary issues. By the way, this can get pretty significant. Look at this image here. This is a ruptured myocardial infarct. So this is heart tissue that was killed by a lack of oxygen, and as a result of that, tore open. So the heart ripped open because of the dead muscle tissue. And that makes sense. Dead muscle tissue is not going to hold together very well. So you've got your left ventricle that's trying to pump, and in this case, it literally tore open. And if you look at that other part of this image, that's the ventricle. And what you can see is that ventricle is not that wide open to begin with. Why? Because this is probably somebody who already was expressing a lot of stress, so that ventricle got large as the muscles had to keep fighting against the high blood pressure they were pushing against. One more type of heart failure, which is pericardial. You remember that pericardial is that sac around the heart. And the purpose of that sac is to allow the heart to move without causing disturbance in the surrounding tissue. So your heart is in your chest. It's in fact, you can see right here in the middle of your chest. So by the way, to be clear, the heart is slightly to the left, but basically in the middle of your chest between your two lungs, as you can see here. So when you pledge allegiance, you really ought to be putting your hand basically in the middle of your chest. You've been pledging allegiance to your spleen. That's not cool, bro. In this case, what's happening is the pericardium, that bag with some slippery viscous fluid around it, which allows the heart to pump, has got a problem. One possibility is pericarditis. Pericarditis means the pericardium has inflammation. When words end in medicine with itis, that means they're inflamed. Okay, so what does this mean? That fluid-filled pouch, the pericardium, has become thick, inflamed as a result of perhaps a disease process or injury. And that is stopping the heart from functioning properly. And you can imagine that. If you wrap the heart in a tight bag that is diseased and inflamed, it's going to interfere with the heart's operation. Another more extreme example could be the result of trauma, that is to say, some kind of immediate injury. And one that is really key here is called tamponade. And tamponade means that the pericardial sac is filling with blood. Imagine this scenario. Imagine you get smacked in the chest really hard, or maybe you get stabbed in the chest, but they miss your heart. But they poke into your pericardium a little bit. Now your pericardium is bleeding, and that blood fills the cavity. So now your heart is trapped in a balloon, and that balloon is filling with fluid, blood. That's going to stop the heart from being adequately able to pump. Strictly speaking, you might say this is not a heart failure because the heart is functioning properly. It just can't function because there's a really tight balloon filled with blood around it that's stopping it from expanding and contracting. But it is considered a form of heart failure because the heart is unable to provide adequate perfusion. And you can imagine this scenario. In an emergency situation like this, a paramedic or an emergency physician would stick a needle into the pericardium, ideally not into the heart. And to do this, they might use ultrasound to guide the needle and make sure they just get into the pericardium and allow all that blood to spurt out. How cool would that be? Stick a needle in somebody's chest, have a bunch of blood spurt out, and suddenly their heart that was barely pumping starts to pump like normal again. Right? That'd be pretty cool. Okay, so those are all different forms of heart disease. Again, you're going to hear about these a lot, and the effects or the symptoms are pretty significant. Obviously, the end result is death, because if your heart doesn't function, you die. It is, as I said, to some degree, you could say it is the cause of all death because we define death as the stopping of the heart. However, in the United States, it's the cause of nearly 1 million deaths a year. That's a lot. What kind of symptoms are you going to experience? Well, you'd expect some of them because I've already hinted at them, right? Weakness, fatigue, exercise intolerance, all those kinds of things because your blood's not going to be able to respond to the demand for further oxygen. And you might feel that pain first in your chest. This is why people are having heart attacks, which is just a general term for all of these possibilities when they happen acutely. So when somebody feels that pain in their chest, it's because their heart is not getting adequate oxygen, right? Interestingly, though, the pain in the chest is not universal. And in particular, women and older people often don't feel pain in their chest. So you can talk to physicians and they'll tell you stories about a woman that comes into the emergency room with a heart attack and the only symptom was like a headache, or the only symptom was significant ear pain or other kinds of craziness. So the reality is we tend to think of a heart attack as having certain symptoms to it, like the pain in the chest, tightness when breathing, etc. And many heart attacks can have that experience, but it's not all heart attacks at all. And in particular, women and older folks tend to manifest their heart attacks somewhat differently. What other symptoms might we experience as a result of heart failure short of a heart attack? Well, edema is going to be one of them. That is to say, swelling in certain areas. Now, why would we get swelling? Because we're going to increase the pressure in the vessels because the heart can't keep up. So you can imagine here, if the left ventricle, for example, is not pumping adequately, so it's not pulling blood out of the lungs, but the right ventricle is operating okay and it's pushing blood into the lungs. What happens then is the lungs start filling up with fluid. There's blood in there at a higher pressure, and that is going to seep through the vessel walls, and that is going to thicken the tissue in the lungs, and that's going to make it more difficult for you to breathe. We call that congestive heart failure. The lungs are getting congested as a result of heart failure, right? In particular, that would be left-sided heart failure. We might get other things. We might get, for example, a right-sided heart failure, which is relatively unusual because the left side works harder, so typically heart failure happens in the left. But you might get a right-sided heart failure, and you can imagine what that might be like, right? You're going to get a backup of blood throughout your body, perhaps. So any kind of heart failure like that might lead to edema. Here's an image, for example, of somebody who's suffering edema in their lower extremities, that is to say, their legs. And you can see that big bullae there, that big water bubble. This is just, and the thickness of the legs and the feet and all that, this is just fluid buildup in the legs because the heart is unable to move that fluid adequately through the vessels. So all of these are potentially signs of cardiac weakness. I should mention, before we end this, that there's certain medications we use for this, and you will have heard of some of these, but I'm just going to quickly mention them. You might know somebody, I don't know, who's on a beta blocker, and a beta blocker blocks beta receptors. Beta receptors respond to what we call epinephrine, otherwise known as adrenaline, and they basically can speed up the heart. And they are what's going to respond, for example, if you start running, your body's going to send signals to your heart, beta receptors, saying, hey, kick it up some, right? That won't be the only signal, but that'll be one of the signals. If we block those beta receptors, your heart will stay more calm. And as a result of that, your blood pressure may go down, your heart may be more protected, and that may be a good thing if you have heart failure. So we use beta blockers. We use ACE inhibitors, ACE, and an ACE inhibitor is angiotensin converting enzyme inhibitor. And there's different versions of this. You might hear some as an ACE2 inhibitor or whatever. We're not getting into that kind of strict division, but you can imagine what angiotensin is. Angio refers to blood vessels, and tensin refers to tension. In other words, an ACE inhibitor stops the constriction of blood vessels and therefore allows the blood vessels to remain more dilated, and that lowers your blood pressure and makes it easier on your heart to pump because it's not pumping against such a firm pressure. We might have calcium channel blockers, and calcium enters the cells of the heart and basically allows for the contraction. If you block some of those calcium channels, you slow the contractions, or ease, I should say, the contractions. So again, it's going to reduce the workload on the heart and calm the heart down some. Each of these have advantages, disadvantages. A physician's going to consider, is this problem vascular, is it high blood pressure, or is this problem principally in the heart? If this person has normal blood pressure but a heart issue, then beta blockers might be called for. If they have high blood pressure, then perhaps an ACE inhibitor might be called for. You get the idea. And there's side effects of all this. So for example, there's beta receptors in the lungs. So if you put somebody on a beta blocker and they have lung respiratory issues, that might be problematic because it might actually slow down the lung responses as well. So you can imagine that physicians have to know what they're doing in these scenarios, right? The last one I want to mention is what's sometimes called a water pill, more properly called a diuretic. And this basically just causes you to pee more, which creates less fluid in your circulatory system. And you might say, what good is that? Well, if you've got a high blood pressure and we can draw some of the fluid out of your circulatory system, then you're going to have lower pressure. And that could be a good thing. And that could ease the situation as well. So diuretics are fairly common for a variety of different reasons, but basically they're one way of reducing blood pressure issues relatively quickly and in a controlled manner. So that's it for heart failure. That's all you need to know. And then I will see you next video when I believe we're going to start talking about the respiratory system. See you then.